Good morning, everyone. Welcome to day 6 of Acharya Red Connect 2025, a premier online webinar series organized by Department of Medical Imaging Technology, Acharya Institute of Allied Health Sciences, in association with Indian College of Radiological Technology. I am Rizwan, your host for today. Before we dive into today's topic, allow me to introduce our esteemed speaker for today. We are thrilled to have with us Ms. Geetanjali, Assistant Professor in the Department of Radio Imaging Technology, Sanskriti University, Uttar Pradesh. She is currently working on a PhD at SGT University, Gurgaon. Ma'am has a strong academic background, having been honored with gold medals from both SGT University and IGMC Shimla in her batch. In addition to her academic excellence, Ma'am has made meaningful contributions to research with 3 publications under her belt. Ma'am will be sharing her expertise with us and we look forward to the insights she will bring. It is an honor to have you with us today, ma'am. Thank you for taking the time to be here. Over to you, ma'am.
Am I audible?
Yes, ma'am.
Thank you for the warm introduction. I'm excited to be here today and have the opportunity to share my insight with all of you. So today I'm going to discuss about very interesting topic, MR spectroscopy. So in today's session, we will cover brief introduction of MR spectroscopy, its basic principle, working, and we will cover some metabolites and their role in MR spectroscopy. So MR spectroscopy allows tissue to be interrogated for the presence and concentration of various metabolites. So it is a non-invasive examination which can give us information on chemical makeup or body tissue. So it is used to diagnose disease and monitor the disease and assess the response to the treatment. For example, if patient is having a tumor and he's undergoing some kind of therapy, for example, radiotherapy, chemotherapy. So MR spectroscopy can help that patient to assess the response of the treatment. So, uh, for example, if you take a lemon and you scan that, you got the spoke-like structure or pattern that is called your MR image. Similarly, if you can calculate a citrate peak of that lemon, that is your MR spectroscope. So uh, routine MRI shows anatomy of the body tissues, and for biochemistry, we have to go for MR spectroscopy. It will tell us about the chemical makeup of the body tissues and about the concentration of metabolites present inside the tissue. So it is an advanced imaging technique used along with the MRI. So first you have to take MRI images, routine MRI images for the anatomy of the tissue, and then it will reveal the complementary information about biochemical composition of imaged tissue. So its clinical uses includes aiding diagnosis of brain tumors and neonatal disorders or any neuronal disorders and metabolic disease related to the metabolites or biochemical present inside the tissues and lesion. And it is most commonly used in case of brain tumors. Uh, for the detection of tumors, we have to undergo a procedure known as biopsy. But in case of brain tumors, it is very risky procedure. So in earlier cases, we use stereotactic biopsy for brain tumors, but after MR spectroscopy, it is very helpful and easiest method to identify and differentiate between the benign and malignant tumors in case of brain tumors. So what is MR spectroscopy? It includes a spectrum of metabolites. So it is kind of a graph that is plotted between the chemical shift and concentration of metabolites. So horizontal axis of the graph represent the frequencies, which means chemical shift, and vertical axis represent the concentration of metabolite. So the peaks which are higher or the area under this peak shows the concentration of that particular metabolite. So here the picture showing a graph or MR spectrum of normal brain tissue. These are the metabolites, that is Na, glutamate, creatinine, choline, and there are many other metabolites present inside our brain. So what is this chemical shift? So MR spectroscopy utilizes the fact that each metabolite will have very slightly different Larmor frequency, which means shift means change. So chemical shift means the change in the resonant frequency of a nuclei of metabolite. So we have already studied some example of metabolites. For example, NAA, creatinine and choline. These are three different metabolites and all three are having three different chemical environments and functional groups. So these all can experience different Larmor frequency. So the frequency of returned signals are then plotted in the form of spectrum. So when the nucleus experiences different local electron density due to the nearby atoms or functional group, its resonant frequency altered. And this resonant frequency is compared with the reference standard uh, chemical shift that we use tetramethylsilane. It is an organic solvent and it is used as a reference molecule. And we assigned the chemical shift for TMS as 0. So all other chemical shift of other metabolites, for example, NAA, creatinine, choline, their chemical shift will be compared with the reference to that DMS molecule. It is an example of a lipid. So this alteration is expressed in the parts per million. This is the unit for your chemical shift or frequency, and it is known as chemical shift. So it ranges between the 4 ppm and 0 ppm. 0 ppm is for TMS and 4 ppm, this is the chemical shift of your water. So every metabolite you see on this graph lies between the water and lipid peak. So this graph is not showing the water peak because we suppressed the water signal. So the basic principle for MR spectroscopy is the chemical shift. And now first step is fat and water suppression. So a most metabolite signal of clinical interest. So metabolites which are of our interest resonate between the resonance frequency of water and fat. So all the metabolites lies between the water and fat molecules. So we have to avoid the interference of fat and water molecules, or we have to suppress the signal coming from fat and water. So for avoiding fat interference, it is very important to plan your voxel placement. So your voxel placement should avoid bone tissue. For example, in case of brain MR spectroscopy, you have to avoid the scalp region. Okay. So by avoiding bone and calcification, you can suppress the fat signal interference. And for water suppression, we use two techniques. First one is CHESS, that is chemical shift selective, and other one is IR, that is inversion recovery. So inversion recovery is most commonly used in routine MRI. I think you all are very well familiar to this technique. So for water suppression, we use flare sequence. In this, we apply 180-degree inverting pulse and with adapted TI. This is time of inversion that required to relax your water molecules till it reaches the transverse magnetization. Then we apply dephasing pulse to suppress the water signal. So why water suppression is so much necessary? So it is mainly because of the concentration ratio of water metabolites, water to other metabolites. So which is 10,000 is to 1. So it is like finding the one metabolite ball in a bucket full of 10,000 water molecules. So our body is mostly made up of water. So the water molecule concentration is higher in our body as compared to metabolites or these biochemicals, which are of clinical interest. So if what happens if we do not suppress water, so graph or your spectrum will look like this. This is the spectrum showing water peak. This is the highest water peak, and metabolites are not clearly visible, and you cannot differentiate between which peak shows which metabolite. Okay. So water suppression is necessary. So what is this chest technique? We use this technique to suppress the water. in this technique, you selectively excite the water molecules only. So you provide a narrow bandwidth. What is this bandwidth? This is a range of frequencies or RF pulse to excite the molecules. So we provide narrow bandwidth of RF pulse to selectively excite the water signal. And after applying this RF pulse, your water molecules get excited. Then it is followed by a spoiler gradient. So this spoiler gradient will dephase the resulting magnetization of water molecule, or the signal coming from those water molecules is got dephased by this spoiler gradient. So now planning of MR spectroscopy. So this is the image showing these blue color bands and red color. Red one is the selected one, and these yellow color bands are fat suppression band or saturation band. These are used for local shimming. So in this image, this is the pathology, and these saturation band are suppressing the signal from surrounding tissue so that it cannot interfere with your resultant spectrum. And okay, these are the sequence we used in MR spectroscopy. First, you have to take the localizer, then T2 axial, sagittal, and coronal images for the anatomy, or these are the routine MRI sequence. Then, first you got the axial, sagittal, and coronal images, then you find the slice. You have to find a slice which is showing clearly your pathology. Then you have to plan your MR spectroscopy on that image. So these are some sequences, that is SPS SV30 MS, SVS SV135, CSI SC30, and CSI SC135. This 135 is your TE, that is time of echo, and this SVS and CSI are two techniques which we are using in MR spectroscopy. So this is single voxel spectroscopy, and another one is multi-voxel spectroscopy. So what is this single voxel spectroscopy? As its name indicates, single voxel. So in SVS, we use single voxel only. So it is used in case of smaller tumors or the smaller pathology, and you use only one voxel and you got the signal or spectrum from that one voxel only. So you got limited data, and but this data is more accurate as compared to multivox. So there are three steps. First one is suppression of water signal by using chess or IR technique, as we studied earlier. Then you have to select the voxel of your interest. So as this image showing, this is the single voxel on, you have to plan it on pathology only, and the rest of the area is covered or suppressed by the saturation bands. So this is the single voxel technique, and another one is multi-voxel spectroscopy, or it is also known as chemical shift imaging. So its main objective is to obtain many voxel and a spatial distribution of metabolite within a single sequence. So in this sequence, you don't have to don't have to plan different sequence, like one single voxel on pathology, and for comparison in single voxel you have to put another voxel on normal tissue, so that you got two spectrums, then you have to compare. But in multi-voxel spectroscopy you can got all the spectrum in one single sequence. You got normal tissue spectrum, you got pathology spectrum in one sequence. So it is used in case of large and irregular tumors or any unknown pathology. So each voxel shows different spectrum according to its chemical makeup, like this. So this is the single voxel spectroscopy, where we put one voxel and we got single spectrum. And in multi-voxel spectroscopy, you got number of voxels, and each voxels represent different spectrum according to the chemical makeup of that normal tissue. So during MR spectroscopy planning, your ROI will be placed at the center of enhancing tumor, covering the lesion. So in multi-voxel spectroscopy, half of the voxels should cover your lesion, and the rest of the voxels should cover normal tissue for the comparison purpose. And we have to exclude subcutaneous fat, sinuses, and bone for the interference of fat signal. And for water, we have already studied that we use chess and inversion recovery technique. So there is another concept in MR spectroscopy, that is short TE, long TE, and intermediate TE. So as I mentioned earlier, these SVS, SC30, 135, these are the TE. Okay, so short TE refers to the 20 to 40 milliseconds. So this short TE is having higher SNR and less signal loss. It is important when you want to see more metabolite peaks in single sequence. So for example, myo-NS, I told glutamate, glutamine. So when we are using long TE, you cannot see these metabolites peak on the spectrum. So short TE is useful in case of uh, where you want higher SNR and where you want more metabolites peak. But in case of long TE, it is around 135 to 288 ms. It is having low SNR and having more simple spectrum. By simple, it means that you got only most common metabolites peak, not intermediate one. Okay, so there is another concept, that is intermediate T. So it is around 135 ms. So it is best for the tumor grading where you want to differentiate between benign and malignant tumors. So here are some steps that you have to follow during MR spectroscopy. First, you have to acquire routine MR images in three planes, coronal, sagittal, and axial. Then you have to find the slice which is showing clear image of your pathology. Then you have to select the volume of your interest. So if there are smaller lesions and you want any early diagnosis or any local or diffuse disease, then you go for single voxel spectroscopy. And if there is large and irregular tumor, or if you want to compare the pathological spectrum with the normal tissue spectrum, then you go for chemical shift imaging or multi-voxel spectroscopy. Then you have to do local shimmy by applying this fat, uh, sorry, by applying saturation band or suppression band for avoid the interference of surrounding tissues. And then we have to for fat suppression, you have to avoid your voxel planning on the bone. And for water suppression, there is a chest technique and IR technique. And then your MR spectroscopy data will be collected, processed, and displayed on your screen. So for interpretation, the area under this peak, these are the peaks of metabolites. These peaks shows the concentration of these metabolites inside your normal tissue. So area under this particular peak represent the concentration of that particular metabolite. So the metabolite which is present in higher concentration provide higher signal intensity and is represent as the highest peak on the spectrum. So this is the image showing spectrum of normal tissue and your brain tumor. So right spectrum, left spectrum is for normal brain tissue. It is showing highest Na peak and lower choline and creatinine peak. And in left side, it is in case of brain tumor, the Na got depressed, Na peak got depressed, and choline and creatinine peaks got elevated. So this is how we differentiate between the normal tissue and the pathology. So here are some metabolites. So there are three most common metabolites which are visible in any kind of TE, whether you are using long TE, short TE, or intermediate TE. So first one is NAA, that is N-acetyl aspartate. So it is showing the largest peak on your spectrum, and it is at 2.02 ppm. So you have to memorize the location. sorry, You have to memorize the location of these metabolites on the spectrum. This horizontal axis is showing the ppm 1, 2, 3, 4. According to this ppm, each peak shows different metabolites. So at 2.02, Na is visible. So it is the neuronal marker. So NA represents our neural health of the brain, and second one is choline. It represent at 3.2. So this third peak is choline peak. It represent at 3.2 ppm. It is a cell membrane marker. So any disease related to your cell membrane destruction cause elevation in your choline peak. And third one is creatinine. It is at 3.02 ppm. The second peak is of creatinine. So it is your energy metabolite marker. So it represents your energy of your tissue. And there is another concept that is choline to creatinine ratio. So here, in case of tumor grading, where you want to differentiate between benign and malignant tumor, you have to calculate the choline to creatinine ratio first for normal tissue, then for brain tumor tissue, then you have to compare this ratio. Then you can identify the kind of tumor present, that whether it is benign or malignant. So there is another concept of good, bad, and ugliest metabolite. So your NAA, it is considered as good metabolite because it represents our neuronal health. So it is a neuronal marker, and if you have good central peak of NAA, it means you are having good neuronal health. So, but here is one exception. In case of Canavan's disease, there is over elevation of your NAA peak. So you have to know about normal range of this NAA concentration. Then you can identify the Canavan's disease, whether it is over elevated or not. So if NAA peak is got depressed or decreased, concentration of NAA represent neuronal loss or any disease related to your neuron, stroke, dementia. These are these can be the diagnosis. So choline is considered as bad metabolite because, as I mentioned earlier, it represents the cell membrane health, which means any disease related to your cell membrane destruction or any disease causing destruction in your membranes, it leads to elevation in your choline peak. So if there is increased in this peak, it can be the because of neoplasia, infarct, or any destructive disease. And if this peak got decreased, it can be due to the hypomagneted ion. And third one is the ugliest metabolite, which is your lipid lactate. So this lipid lactate peak represent the necrosis. So any disease related to your cell death where cells got destructed. So for example, your necrotic tumors or TB, it shows elevation in lipid lactate peak. So this is the ugliest metabolite. So as we summarize today's session, so MR spectroscopy is a non-invasive technique. It is very helpful in case of differentiation of benign and malignant tumors, and its basic principle is chemical shift, where we got one reference molecule, that is TMS, which is considered as zero chemical shift, and we compare the frequencies of other metabolites in reference to TMS. Then we have to suppress water and fat signals so that we get accurate spectrum from the selected voxel, and you have to decide whether you want to go for SPS or MVS. So how to acquire good spectral wave? First, you have to acquire MR images. Then you have to apply saturation band in adjacent areas to prevent the contamination of surrounding tissue. All the voxels should properly shimmed, and you have to make sure that you are getting data from only selected area or selected voxel, and all other part signal is suppressed so that final signal do not get contaminated. Okay, so this is all for today. So if anyone is having any kind of questions regarding the topic, feel free to ask.
Hey participants, please feel free to ask any questions that you may have. You can type them into the chat box.
Yes, the signal from fat and fluid will be suppressed in MR spectroscopy because we do not want interference from fat or fluid signal. It is most commonly used in case of brain tumors where we do not want to go for stereotactic biopsy. So in case of tumor grading, it is most commonly used. But any neuronal disease or disease related to your brain health, here the MR spectroscopy is used. Yes, it can be used in case of prostate tumors, but uh, in prostate tumors, it is we prefer biopsy in case of prostate tumors. But yes, you can also use MR spectroscopy. References. MR spectroscopy is used along with your routine MRI. It is advanced sequence or imaging technology which you are applying on your routine MRI images. It cannot be MRI can be used with your PET, but MR spectroscopy cannot be used with your PET scan. Ref- Okay, limitations of MR spectroscopy as general, you have to plan very carefully your MR spectroscopy or your placement of your voxel. There is more chances of interference of surrounding signals if you do not plan your voxel clearly, if you do not apply your suppression band clearly. So it is you required highly qualified or highly experienced person for this, and susceptibility artifact can degrade your spectrum in case of MR spectroscopy. Rest, it is time consuming.
Ma'am, one of the questions is what way we can improve precision and reliability of metabolites quantifications?
I think this question is not relevant to the topic. It so in case of brain tumor, it is reliable uh, meta MR spectroscopy is more reliable in case of benign and malignant tumor differentiation. In case of brain tumors, yes, we can identify another pathologies also, like your Alzheimer disease, your stroke, or any neuronal disease, or as I mentioned earlier, you can identify TB also in with the help of MR spectroscopy. So it is not only focused for your brain tumors differentiation, but you can also identify another neuronal disease or your brain disease. What are the chemical shift? So this shift means change, or chemical shift means the change in the frequency or Larmor frequency of your metabolite because of its chemical makeup, the functional group attached with your metabolites and the chemical environment of your metabolites. Because of this chemical environment or different chemical makeup, your metabolites will experience a different Larmor frequency, which lead to the uh, which lead to the different precisional frequency and different signal with reference to your TMS molecule. So in MR spectroscopy, we take TMS as a reference molecule. We assign the chemical shift to 0 to the TMS. Then in comparison to TMS, we identify the shift or change in the metabolite concentration. Other than brain tumor, we can identify your Alzheimer disease, your abscess, stroke inside your brain, TB. Yes, you can take MR spectroscopy with or without gadolinium, but we see if your tumor is easily visible in your routine MR images, then you go for without gadolinium. And if it is not clearly visible, or if you cannot identify the location of your tumor clearly, then you can use your MR spectroscopy after using gadolinium. So gadolinium help to specify your or high it make your tumor hyper intense and clearly visual. Then after gadolinium, you can use MR spectroscopy.
Is there any more questions?
So in case of MR spectroscopy, we prefer global shimming, which we achieve by using shimming coil in your magnetic bore. Then we apply local shimming, that are your suppression band or saturation band, adjacent to your selected voxel. See, MR spectroscopy is not image, it is showing spectrum or graph. So you cannot actually see artifacts, but yes, your spectrum got contaminated because of your surrounding environment and surrounding signal interference. So it can add to the limitation of your MR spectroscopy, that you cannot identify whether it is the artifact or whether your spectrum is accurate. If there is any interference of surrounding tissue, you cannot identify that.
So if there are no further questions, we can wind up the session. Thank you, ma'am, for your fascinating presentation. We really appreciate how you simplified the techniques behind MR spectroscopy while highlighting how it can analyze metabolic changes within the body. I am sure your session has deepened the knowledge of our participants on spectroscopy. We thank you wholeheartedly for your time and efforts, ma'am. Before we conclude, let me brief the participants about the next speaker for tomorrow. We have Professor S. Panir Selvam, Adjunct Faculty of Medical Physics, Sri Ramachandra University, Chennai, Tamil Nadu, who will be speaking on advances in detector technology in CT. Once again, our sincere thanks to Ms. Geetanjali for sharing such valuable insights to us and to all the participants for their active engagement today. We hope that you found the session useful and informative, and we look forward to welcoming you again tomorrow for another enriching session at 11 a.m. Until then, take care, stay safe, and have a wonderful day.